Well, speaking of rates and fees, it's something many people pay for every day, sometimes begrudgingly. We're talking about parking. And now questions are being raised. Should parking fees be charged at hospitals? Dana Hutchings has more in tonight's Checkpoint.
Stacey, parking fees are in effect at most hospitals, but now an editorial in the Canadian Medical Association Journal says hospital parking fees are essentially a healthcare user fee. Should it be scrapped, or is the revenue necessary to pay for equipment and services? Here's Kristen Robinson.
It's a ritual many Canadians would rather not buy into. Hospital parking fees add up. At Royal Jubilee in Victoria, plugging 25 cents into these meters will get you 10 minutes.
Terrible to make people pay so much money when they're going to go visit someone who's sick or if they're sick themselves.
I think they're too high, and I love visiting people, but then they charge too much.
We come for a day surgery, and then we go through the same ordeal every time.
I don't think it's right. It does put stress on people.
And one doctor agrees, equating hospital parking fees to a user fee in disguise. In an editorial in the Canadian Medical Association Journal, neurologist Dr. Regenda Kale says hospital parking fees are a barrier to health care and add avoidable stress to patients who have enough to deal with already.
Now, on one particular occasion, I was seeing a patient who had episodes of being unconscious, and her husband was driving around because he did not want to park, and he really should have been there and talking to me, and he wanted to do that.
Well, I completely agree with that. I just think it seems outrageous to take advantage of people who are sick or visiting the sick.
Absolutely, I agree with that. Yes, 100%.
I don't agree with what he's saying. I don't really think it's a user fee in disguise. I myself, it's a necessity to pay for things.
Losing net parking revenue would make a dent of about 1% in most hospitals' total revenue.
It helps to offset operational support services, patient services, and of course the cost of maintaining and repairing the lots. Parking rates and fees aren't just important for revenue, but it's important for ensuring there's spaces available to those that require them.
If hospitals here were to scrap parking fees like they have in Scotland, where up to 4-hour free parking has been offered since 2008, the health authority says lots would be filled by staff and patients and visitors would have to scramble to park off-site.
And our Checkpoint question tonight, do you think hospital parking fees should be eliminated? You can tweet us at @check_news, post on facebook.com/checknews, or email checkpoint@checknews.ca. And that's the question in our web poll as well. To vote, you can go to our website, www.checknews.ca. Stacey, the editorial uses the example of Wales and Scotland, where health authorities did away with hospital parking fees in 2008. It's an issue that's raised a lot of debate. Our Checkpoint question, do you think hospital parking fees should be eliminated? Here are some of your answers.
Yes, absolutely. I was just going through this, actually 2 weeks ago. Absolutely, I do.
Why is that?
It's expensive. When you're using your facilities, you're kind of handcuffed. You have to, absolutely have to pay it.
It's an essential service. You have to go to the hospital, and I don't think you should have to pay.
It should be free, but I also understand the hospital has to make money, so.
I think it's absolutely silly that we even consider making people who need to use hospital services pay for parking.
No, I think it's just add additional expenses to the health care. So no, I think it's fine, and I've paid it, and I will pay it in the future.
Oh, I think that would be a wonderful idea.
Yeah?
Yes, I do. That? Because it's really, really expensive, and if you have to go for a test or something, it costs you an extra $10 or so.
From Twitter, Cheryl says, yes, parking fees should be eliminated. I'm a cancer patient and shouldn't have to pay additional charges for treatment on disability. Anne Marie says these fees can go far to helping pay for much needed hospital capital. We should keep them. Sheila says, yes, it should be eliminated, absolutely without a doubt, with some sort of check-in ticket or something similar, so it's not being abused. And the results of our web poll, 85% of people say they believe parking fees should be eliminated. There were also a lot of comments on Facebook and Twitter today about the price of parking fees being lowered. That way there's still revenue for the hospital, but it's more affordable for patients as well. And that's tonight's Checkpoint.